vascular complication when you inject a face. So we did with Dr. Winter this very precise dissection, step by step, and you know, first the subcutaneous dissection. Very precise, very superficial subcutaneous dissection to show you first the fat. And when you see this half face, the left side of the patient, you will see this very extended lateral fat flap. And then you see that around the holes of the face, the mouth, the nose, and the eyes, there's no more real fat. I remove the fat, the malar fat pad, the inferior face fat, and then I will show you muscles, deep and medium fat, but mainly the arteries. If we begin by the lower face, in that case, you will follow here the fascial artery when it crosses the mandibular line, and then you will follow it here, and you see this artery. We injected the cadaver yesterday, so you can see artery in this pink color. And the plane is very important, the plane of artery, because in that case, this artery is below the platysma, cross the modulus below the DAO and the zygomatic major, and then you will find this artery here. So below the muscle planes, with branches, look, very nice dissection of Cecile, you see here, branches for the upper lip, and you find the same here, branches below the depressor angulioris muscle, branches, arterial branches for the lower lip. It's very important to see because, you know, they are big artery, and when you compare the size of a needle and the size of this artery, you can understand that it's possible to cross if you inject in the same direction than the artery, to cross the first wall of the artery and to inject intra the artery. It's possible when you inject here the lower lip. It's possible when you inject here the upper lip. And then we follow this artery. And look, what a surprise, what is the real dangerous area? This is the classic area where we injected, since many years without any problem, the nasolabial fold. And you can find this artery and little branches, in that case below the fat, but in that case below the muscles. You have here the zygomatic minor, the levator labii alaquenasi, and then this artery crosses muscles by the deep plane. And sometimes I can show you some videos, and perhaps you will see another videos of anatomy tomorrow. Sometimes this artery is on the muscles, and in that case it's below the muscles. And you can follow it here, you know, in the lateral part of the nose, and branches for here, the nose, and you can have communications between the two sides, between the right side and the left side, with, you know, all branches from the carotid extern system will cross together the two sides, and you will have communication of the two systems. But what is important is not the communication with the two external carotid systems. The problem is if you follow this branch of the facial and, you know, here along the nose, you follow it until the intracanthal area, but you follow it in the globular area here. And then you can see the communication between the supratrochlear arterial system, here you have a little branch, from the internal carotid system. And then if you have microembolization from this injection, for example, in the nasolabial fold, okay, the microembolism will follow the way of the blood in this artery, and if you inject it with a very high pressure, you can observe a microembolization, retrograde embolization in the internal carotid system, and then you can have blindness with, an obstruction of the retinal artery. So you understand why, with an injection very low in the nasolabial fold, you can have, very bad and, very dramatic complication around the eyes and with blindness. And when you inject the glabellar area, you can find here little arteries, and with needles, you can inject here, and the same, you can have obtained obstruction, embolization, and necrose of the soft tissue. So it's a very precise dissection. You can follow from the angle of the mandibular line, you can follow this artery, you can follow different branches, and then you can understand the danger. The danger is to inject inside the artery. So how to avoid it, and what is the best solution to avoid complication? When you in the classical anatomical position like this with the fat on the place,